NAU's researchers are on the front lines responding to the coronavirus pandemic, looking for effective ways to track and treat the virus, potential vaccines, how it's affecting the supply chain, and how Americans are responding. Microbiologist Paul Keim, a research professor and director of the Pathogen and Microbiome Institute at NAU, is leading a statewide research effort. Paul sat down with NAU-TV to discuss the progress scientists are making.
Dr. Keim, great to talk with you, even though it's virtually. Appreciate your time very much. The PMI, the Pathogen and Microbiome Institute at Northern Arizona University, is playing an important role in the fight, the battle against COVID-19, this novel coronavirus, the pandemic that has swept the globe and has had such a profound impact on all of us in the United States and everyone across the world. Talk to me a little bit about that and some of the work that you're doing right now.
You know, I've spent the last 20 years of my career building an infectious disease research unit here in Flagstaff that includes, of course, NAU and TGen North. We probably have close to 150 people now at PMI and at TGen North. And at this point in time, it's just an all hands on deck. Everybody is moving towards solutions to the COVID-19 problem. We have people who are doing mathematical modeling, trying to understand how this disease is progressing and watching locally on how it's progressing and making mathematical predictions for what its impact's going to be next week and in a month. We have people who are now doing what I call in vitro testing, and that's where we're taking drugs that might be useful against fighting this virus and testing them in the laboratory before they would be deployed out to be tested in human studies. This is a way to rapidly screen a lot of possible drugs that could be useful and relatively cheap. We have folks who are working on the diagnostic side. TGen North has been fantastic in standing up a CLIA lab, which is now responsible for a large portion of the Northern Arizona PCR testing. We've been working on serological tests, and so we've developed the ability to monitor antibodies in people. That's a whole different team. So it's just like everybody is doing this, and we're doing it under the conditions that everybody else is doing it under, restricted contact with other people. A lot of us are working from home, but some folks who are considered essential for the operations in the laboratory are still coming in.
The coronavirus presents some unique challenges to do the research and to do the work that the PMI does to try to defeat it. Is it a little bit different in the PMI in terms of the safety protocols, the workplace conditions?
We work with very dangerous pathogens, and so that type of work we're used to. We work with anthrax, we work with plague, we worked with cholera, and when we're investigating a disease outbreak like we did in the anthrax letters, it was very intense. But what we didn't have is we weren't worried that we were going to go home and catch the disease that we were studying. And so that layer of anxiety, it takes a toll on everybody. And so our big testing programs are being performed as well as we can with social distancing, but there are just some limitations to how much we can do in the laboratory. There's only so much room to get the work done. But this is so important that these additional personal risks are just part of the job right now.
Paul, can you share some information about what the COVID-19 Genomics Union is? It's a fairly unique, broad-based effort to bring together a lot of different organizations and entities like the PMI at NAU to be a team, if you will, and going after and finding the solutions that are going to get us through this COVID-19 pandemic. What is that?
So in Flagstaff, we have unique infrastructure. We have the high containment laboratories where we can actually handle and study the COVID-19 virus. That's unique. It's not very many places in the United States and almost nowhere else in Arizona that this can happen. So if we're going to make an impact in Arizona, we can't just sit up here in our castle and work by ourselves. We have to develop this network of collaborators across the state of Arizona and indeed across the world. But the Arizona COVID-19 Genomics Union was established by myself, Dave Inglethaler at TGen, and Mike Warraby at the University of Arizona, and now Brenda Hogue at the Arizona State University. So we have these four, really preeminent institutions in Arizona, and rather than try to be lone cowboys doing our own little science in our different institutions, we reached out and established this union and build upon each other's expertise to understand how the disease is spreading in Arizona in a more in-depth fashion. So what we've been trying to do is sequence the genomes of viruses from as many positive patients as we can and start to build a genomic model for how the disease came into Arizona and how it's progressing. And what we can see is for example, the very first case in Arizona, which was in late January, was really a dead end. It didn't spread deep into the community. It was controlled and snuffed out. That's in contrast to a very similar situation that occurred in the Seattle area, where there was an early case. They thought they'd controlled it, but 4 weeks later, they discovered, in fact, that person had spread the disease widely around the community, and it exploded up there. And we don't really see that type of community transmission in our data until really the middle of February. And so that's when there were multiple introductions of the virus from around the United States primarily into Arizona. Although there are some linkages back to Europe, it's interesting that most of the cases we're seeing in Arizona are derived out of the European outbreak as opposed to directly out of China. So the Genome Union is able to do that because we share data across the institutions, and we share expertise. And we've really been able to advance the science here in Arizona in a way that's informing public health and will help us understand where we've been, but also where we're going to go in this disease.
Is this something that you could see, this type of a union of different entities, something that could be used in the future, not just for COVID-19?
In a sense, we invented this back in 2001 when we started generating big databases on anthrax and other pathogens. It took about another 5 to 10 years for the technology to get cheap enough to then apply it to other problems. But currently in the United States and indeed around the world, there are similar type of tracking unions for tracking foodborne outbreaks like E. coli. And so there are big national and international databases for foodborne pathogens already. And indeed, in the COVID-19 example, there are global efforts going on and national efforts going on. What's different about this is we're taking this to the regional level. In other words, we know what's happening in Arizona. We're not waiting for some federal agency to tell us what's happening in Arizona. We're digging in and doing it now and doing it in real time in order to help the citizens of Arizona.
I'm hearing an undertone of optimism. Am I reading that correctly? Is there reason in your mind, Paul, to be optimistic about what is going on, not just at NAU, but even globally, to fight this global pandemic?
Yeah, well, I'm always the optimist. I think that this is a very, very serious situation, and we've got months and months to go through before we come out the other side. But we're seeing some advancements in science that are taking place in real time right now that are unbelievable. The technologies that are coming to the forefront for the vaccine development. Because this is such a serious problem, there are over 100 different vaccine efforts underway using at least a dozen different technologies. Some of these technologies have the promise to create a highly effective vaccine with very few side effects. They're brand new. They've been used in animals, and they've been used in pilot studies. But this would be, if one of these proves to be safe and effective, it'll be the first time it's ever been used at this scale and this fast. You know, the previous record for a vaccine was 4 years from start to approval, and 4 years. That was the record. More common was 10 years, and 30 years was not uncommon to get a vaccine from start to finish. And now we're talking about moving multiple vaccines forward in 12 to 18 months. And when that happens, it's going to be an amazing technological advance, and it will prepare us for future pandemics. No one should fool themselves into thinking that this was the first pandemic that we've had in our lifetime, and nobody should think it's going to be the last one either. But when we come out the other side, we're going to be much better prepared in the future, much more cognizant of the risks of future pandemics, and much better able to handle those in the future as well.
It is comforting to know that you are on the job, that you are all safe, and that you are determined to find the solution that will lead us to that back end as you're talking about. Continue to stay safe, my friend, and thank you for joining us, and we'll look forward to catching up with you again in the future.
Thanks a lot, Mitch. I appreciate it.